Come in.
Hi, Henry. My name is Jenna. I'll be your nurse today.
Well, hi there, Jenna.
How are you doing today?
Oh, I'm going.
Yeah? Can I get your name and date of birth, please?
Henry Cavill. Date of birth.
Thank you. And now I'm just going to scan your wristband to make sure we got the right wristband on you. Okay. So, Henry, can you tell me what you're in here for today?
Well, I'm in here for pneumonia, they tell me.
Okay. How has that been doing for you?
Oh, I've been coughing a lot, but...
Yeah, it's... How has your green drainage sputum been recently?
I've been coughing up a lot more of it, but they tell me that's good, so...
Yes, it is, actually. All right. Would you mind telling me where you're at?
I'm at University Hospital.
Okay, and do you know what today's date is?
To be honest with you, I don't, but I think it's around mid-December.
Okay, thank you. All right. How has that cough been for you? Have you been experiencing any pain?
Yeah, honestly, some.
Yeah, whereabouts is your pain?
Just my stomach from coughing so much.
Yeah, how long has that been happening for you?
Last day or so.
Okay, would you mind rating that on a scale of 1 to 10 for me?
When I cough, a 6.
Okay.
But when I don't move, like a 4.
Okay. All right. Has this cough been keeping you awake at all at night?
Yeah, I'll wake up in a coughing fit.
Yeah.
Sometimes I sleep through it. The nurses think that's funny.
You sleep through your cough?
Sometimes.
All right. And how have your bathroom habits been recently? Everything going well?
Well, it's not unusual. I've been going.
Yeah?
Mm-hmm.
Okay. Regular peeing and passing stool and everything?
Regular for me. I don't know what regular is for you, but...
Okay. And any allergies we should be aware of?
I'm allergic to sulfa drugs. That's it.
Okay. I'll make sure that's in your charts. All right. Let's see. So you have a nasal cannula on. How's that working out for you?
It's a little dry, but I can breathe easier now.
That's it. The correct leaders, okay. Yeah, it's getting your nose a little dry.
Just a little.
Yeah. That thing can be quite annoying. All right. And let me see that IV site on your left arm here. How's that been doing for you?
It's been fine.
Okay. Your skin looks very well intact, so that's good. And your bag. Correct medicine, okay. All right. I'm just going to take some vital signs on you. Is that okay?
I guess so.
All right. Put that on your finger. I'm going to put this on your arm. Okay. Where does that turn off again? Is it dead? Okay, so I'm going to go ahead and press this button and your blood pressure cuff is going to swell up and put some pressure on. And while that's going, I'm going to take your temperature. Do you mind lifting up your tongue and putting this underneath there for me? Thank you, and this will just take a few minutes. Okay, thank you. Take this off. And your blood pressure cuff. All right, let me write down those numbers real quick. All right, your temperature looks great for the pneumonia. All right. Okay, now I'm just gonna listen to some heart and lung sounds. So I'm gonna have to take your gown off a little bit so I can get down onto your chest.
Okay.
All right, here we go. Just take some normal breaths for me. Okay, listen to the heart sounds for a minute, and the front lung sounds sound great. All right, I'm gonna ask that you sit up a little bit for me so I can listen to your back. I'm supposed to do this on the mannequin. Sit up just like that, perfect. And if you can go ahead and just breathe normally for me, I'm gonna listen to a couple spots on your back. Okay. Everything sounds good. I noticed that you do have a little bit of crackles going on in your upper lung fields, but that is normal for pneumonia, and everything seems to be persistent with how it was in the past. Sorry, I don't know how to put your gown back on. Okay. All right. Now I'm just going to lay you down a little bit and take a listen to your bowel sounds. All right, I'm going to lift your gown up and pull the blanket down a little bit so I can see your stomach. Simulating that I have listened for 5 minutes of bowel sounds. Your bowel sounds sound really good, Mr. Henry. All right. So I would like to go ahead and check your pupils. So I'm just going to shine a light in your eyes. And if you could just look at me and try to keep your eyes open, okay?
All right.
Okay, here we go. Ready? Thank you. Pupils were reactive and constrictive and dilating. Okay. Normal size as well. Okay. Would you mind grabbing both of my fingers with your hands, please? Thank you. I'm going to go ahead and check your pulses while I'm here. Thank you. All right, can you do me a favor and push down on my hands like you're driving a car? Good. And reach your toes up to your knees, up to the sky. Thank you. Now I'm just going to check your pulses here too. Perfect. All right. Everything is seeming to look very well, Mr. Henry. The last thing I got for you would be to teach you about the spirometer. Has anybody told you about that?
Yeah, kinda.
Yeah? Okay, so what we want to do is get you to use this 5 times every hour. This is going to help get the air to the base of your lungs where you have all of that fluid in there, and we want to try to get rid of that. So what you're going to do is take a nice inhale, breathe in, and then when you breathe out, I want you to breathe out into this spirometer, okay? You're going to do this 5 times every hour. So like in between commercial breaks or during a conversation, take a pause and just try to remember to do this, okay? So let's go ahead and practice for me. Just take a nice deep breath in and then blow into the spirometer, okay? Simulating that he took a breath in and blew out into the spirometer 5 different times. And you can take a break in between each breath, okay? Don't make yourself get lightheaded, okay? So you're just going to use that 5 times every hour, okay?
Okay.
And I want to make sure it's nice and close to you. And also we have this spit basin here for you. Anytime you cough up, we ask that you do like cough up your sputum into this in case we need like a sample or we just want to check to make sure everything's okay with the sputum.
All right.
All right. Okay. Let me double check here. All right. I'm going to lower you back down to a safe position. And then I'm going to leave you be. But we do ask, since you have a nasal cannula in, an IV, that if you do have to get up to go to the bathroom, that you call us on your call light, which is this right here, right next to your left hand, the big red light or button. You're going to press that and we'll come and help you to the bathroom so you don't pull out your IV.
Okay.
All right. So here is your table with your spirometer and your spit basin. And remember, how many times are you gonna do this? If I can get it out right?
5 times per hour.
5 times per hour. Good job. Thank you. Okay. All right, Mr. Henry, you have a great day, and I'll be back to check on you in a little bit, okay?